If you can tell someone had plastic surgery, it's already too much. But the best work, you see it every day and you don't even realize it. You've probably looked at someone and thought, wow, they look really good lately. Not different, not done, just better. That's what current good plastic surgery actually looks like. There was a time in recent past that the most popular plastic surgery results were the most dramatic, the amazing transformations. My career has included 21 years in the Air Force and then my private practice here in San Antonio. So I can't personally vouch for this, but I've been told that certain geographic areas, like Beverly Hills, prided themselves on having dramatic transformations that made the patients unrecognizable. Some colleague even told me that people actually purposely go to these areas in order to get surgery so they look very different. But despite this trend, when I trained, there were still many surgeons who always believed that good plastic surgery should not look like you've had plastic surgery. The goal has always been to enhance the person's appearance in a natural, subtle way. And now we're seeing that pendulum swing back to the natural result goal. Subtle result, a rejuvenated, more refreshed you is now the goal. But people typically don't recognize good plastic surgery. They only notice the bad, the overfilled faces, the tight skin, the obvious changes. But the best results, they don't stand out, they blend in. So let me show you what to actually look for. The first sign is simple. You can't tell anything was done. They still look like themselves. Same expressions, same identity, just more refreshed. Because natural doesn't mean untouched, it means undetectable. The second sign is balance. Good plastic surgery is not about fixing one feature, it's about how everything works together. The face is a system, and when one part is overcorrected, your eye feels it, even if you don't know why. That's when results start to look off. And the third sign is movement. When someone smiles, talks, or shows emotion, it still feels natural. There should be softness, variation, life. If the face looks stiff or frozen, that's usually a sign someone was pushed too far. The fourth sign is subtlety. Good work doesn't try to make you look like someone else or like a filtered version of yourself. It just brings you back to the center. I've had patients tell me, I don't want to look different. I just want to look like myself again. And that's the goal. And the fifth sign is this. You notice the person, not the procedure. You're not analyzing your face. You're just thinking, they look great. Nothing pulls your attention. Nothing feels distracting. The best plastic surgery is invisible. If people are trying to figure out what you had done, that's usually not the outcome you want. As I mentioned earlier, good plastic surgery should not look like you had plastic surgery. If you're considering procedure, this changes how you evaluate results and who you trust. Because a good surgeon is not trying to make you look different. They're trying to make sure no one can tell anything was done. If this helped you see things differently, subscribe for more, and if you have questions, leave them below. I'll answer as many as I can.